Thank you for joining us today for this webinar about supplements and how you separate the science from marketing hype. Randy and I are really excited to present this material to you, and we hope that it's valuable to you. We hope that there's some good opportunities to boost the level of education that you have on this topic. So just a little bit of information about ourselves. My name's Eric Collett. I'm the CEO of A Mind for All Seasons, and I've been working with seniors living with dementia since about 2000. So a lot of my work is informed by that involvement with those living with dementia. And Randy Vawdrey is the Chief Medical Officer of A Mind for All Seasons. And he spent about as long as I have also working with seniors, but he's also run primary care and urgent care practices. He still sees patients regularly throughout the week in those practices. He's also run a weight loss clinic and a supplement store and a med spa and other businesses. So we're excited to be here with you and really dial in on supplements and how we can separate out all the glitzy marketing campaigns from what's actual science. So just to set the stage, I want to point out that if we've learned anything from the COVID-19 pandemic, we've learned that health is really wealth. It doesn't matter how much money a person has. If you don't have your health, things aren't as good as they could be, and you're limited in what you're able to accomplish. I've talked to so many people in the last year who have really recognized that they need to take as good a care of themselves as they possibly can. And the time to be healthy is before a major illness sweeps the world. We want to have the best health possible at all times. Now, gravity's going to have its way with all of us. Nobody's going to cheat death. But in the space that we have between the time that we're born till the time that we die, how we live and how our bodies are functioning has a lot to do with our other capacity and what we're able to do and how we're able to influence people in the world. Sometimes, though, when it comes to health, we feel a little bit like a boat out on the ocean without any wind and without any oars to row with. Do you ever feel like you're just kind of drifting, trying to figure out how to get healthier? You know you want to be healthier. You know you want to move in some positive direction. Maybe you have a vague idea of what really optimal health would look like. Maybe you even have some specific challenges that you want to work through and try to overcome. And yet you're lacking in some sort of direction, some sense of how to move forward and how to get to a better place. Oftentimes when people are struggling with things like that, they're looking for the chance to feel like they're doing something, the chance to take action in what feels like a meaningful way. Well, a recent study showed that 77% of US adults take supplements of one sort or another. It might be a multivitamin, or it might be a weight loss supplement, or it might be something to try to deal with a mental health problem in a fairly natural way. Most people, though, take supplements. And when it comes to the supplements they take, a lot of people are taking things because they've heard that it's good, or it sounds like it would be a good thing, or grandma said to take your vitamin pills. And yet it's easy to wonder if we're doing something that's actually having a difference. Sometimes people in the United States are criticized as having the most expensive urine in the world. And I think maybe there's a little bit of truth to that, because sometimes we just take things that sound good, or we've seen an advertisement for something, and we have a vague idea that we want the outcome that that supplement may have to offer. So how do we begin dialing things in when we're faced with the kinds of staggering array of choices that we have every time we go to the pharmacy or the grocery store or the health food store? Maybe, for example, you've read that vitamin D is really beneficial. And so you've decided, well, I'm going to take some vitamin D. So you go down to the health food store or the grocery store, and you find that there are 10 different vitamin D supplements, and they're in all sorts of different strengths, and you have no idea what to do or where to start with that. How do you begin to go forward? How do you begin to have some confidence that what you're doing is even a good choice? And maybe you've heard that taking too much vitamin D can be a problem. Well, how do you know if you're taking too much? What is the sweet spot? What's the right brand? How do you sift through it? You get the idea here. As you begin to sort through all of these questions that come up, it gets trickier than just going to the store and trying to do something positive for your health. Well, we hope to give some clarity in those areas. And if we're going to do that, we have to draw on our own experience. As I mentioned in our bios, Randy and I have spent a lot of time serving people living with dementia. Now, I realize that most of you on this call probably don't have brain fog or mild cognitive impairment or even subjective cognitive impairment. I bet that most of you that are watching this are in relatively good health. You're just trying to understand a little bit more about supplements. But I want to share some things about what we've learned in taking care of people with very serious neurological dysfunction, because they teach us some things that we can apply universally when it comes to supplements and how they work and how we begin to answer some of the types of questions that I raised earlier. So here's a few statistics that might be interesting about Alzheimer's disease, which is the most common form of dementia. 1 in 9 adults that are 45 and older report some symptoms of cognitive decline. And 1 in 3 seniors dies with Alzheimer's or another type of dementia. So if you live long enough, it's basically like a roll of the dice, whether or not you're going to have major cognitive decline. There are more than 5 million Americans living with Alzheimer's right now, more than 50 million people worldwide, and that number is expected to go up dramatically in the next 20 to 30 years. Part of that is because people are living longer, and part of that is driven by what we're now learning about the root causes of Alzheimer's and other types of cognitive decline. So stay with me here. This is all going to tie together as far as supplements and what we can understand with it, but let me share with you a little bit of how Alzheimer's works. If you look at this image, you can see that compared to the healthy brain on the left side, the Alzheimer's brain is a lot smaller. It loses 50 to 70% of its mass. And you'll notice that right toward the bottom of the brain, just above the brainstem, there's an area that in the graphic on the right is labeled the hippocampus. That's basically the memory control tower of the brain. And that is ground zero for Alzheimer's disease. Most cases of Alzheimer's start in that area. That's the memory center of the brain. Well, you don't get to the point that the hippocampus is basically a crater, like you can see in the diseased image, if you don't start losing brain cells faster than they're being formed at a pretty rapid rate. You see, we've learned in the last decade or two that the hippocampus, the memory center of the brain, produces more new brain cells every day than any other part of the brain. So literally there's like a tipping that occurs. And there are a lot of different factors that cause that tipping. And once this disease process starts, it starts to affect the whole rest of the brain, and you get pretty widespread devastation. So that by the end of Alzheimer's disease, a person functionally is just like a newborn. They can urinate, they can defecate, they can cry, they can't roll over on their own, they're on a thickened liquid diet, they usually can't put words together. So it's a devastating kind of neurological disease. Well, how does this tie into supplements? Well, first of all, there's no pharmaceutical magic for Alzheimer's disease. There have been over 400 drug trials at massive expense to this and other countries, and we don't have a pill that will cure Alzheimer's disease. Part of that is because that one pill would have to do 40 or 50 different things. It's like trying to patch a roof with many different holes by only focusing on one hole. The human body is a system. Everything works together. And you can't fix a complex system by only addressing one variable. This is what has caused so many pharmaceutical companies to begin pulling out of Alzheimer's research at all. They've begun to recognize that no one treatment will make a difference. Well, Dr. Dale Bredesen is an MD neurologist who's been studying Alzheimer's disease, trying to figure out how to deal with it for about the last 30 years. And a lot of that time has been spent developing pharmaceutical agents. And along the way, he realized that there's basically a switch in the brain that can get flipped. It can go one direction toward cognitive improvement and synapse growth, or it can get flipped the other direction toward cognitive decline and destruction. Basically, this switch is asking the question all the time, can we support this vast neural network, or do we need to downsize a bit? And if we need to downsize, well, how small do we need to get? As he began studying out this switch and how it works, he realized that there were many factors that affected it. And here's where supplements tie in. He realized that nutrient and hormone deficiencies are major players, along with chronic inflammation and insulin resistance and toxicity and lifestyle factors like how much you're sleeping, whether or not you're getting enough oxygen as you sleep, how much you're exercising, how intellectually active you are, and other things. Dr. Bredesen decided to take 10 people and measure as many of their nutrients and hormones and inflammatory markers and markers of toxicity as he could, and to develop a really personalized program for each one. So he wasn't giving them a multivitamin. He was basically saying, your vitamin D level is here, and to be optimal, it should be there. So you need to take X amount of vitamin D, or vitamin E, or magnesium, or pregnenolone, or DHEA, or on and on and on. Well, he published the results of that initial pilot trial with 10 people in a landmark study in 2014 titled Reversal of Cognitive Decline, a Novel Therapeutic Program. And he talked about how 9 of these 10 people had really remarkable improvements. One individual had a hippocampal volume measured on an MRI. So again, the memory center of his brain was measured on an MRI, and it went from the 17th percentile up to the 75th percentile. This person regrew a lot of their memory center, and outwardly they were far more functional. Well, as Dr. Bredesen went on to apply those techniques to other people, he found that what gets labeled Alzheimer's disease is actually a lot of different things. For some people, it's really an inflammatory state. He calls it a hot type of Alzheimer's disease. And there's a lot of description here on this slide that I'm really not going to get into for the sake of time. If you want to delve deeper, we can address some of that in the Q&A at the end of this. But basically, some people are inflammatory. Some people have insulin resistance or glycotoxicity as a major driver. Some people have an atrophic type of Alzheimer's where they're really lacking in nutrients and hormones. And some people have more of a toxic component. They have things like heavy metals or mold or Lyme disease or herbicides and pesticides that are built up in their system, plastics and other chemicals that are affecting the way that their body functions. And when it comes to these different subtypes of Alzheimer's disease, there are various supplements that may be beneficial. And Dr. Bredesen used supplements in treating all these various types. Well, Randy, our chief medical officer, who you're going to hear from in just a few moments, received some direct training with Dr. Bredesen after he had already done a whole bunch of his own research into Dr. Bredesen's work. And as Randy has further developed his understanding of what drives cognitive decline, he's found that using targeted supplements may be the real driving force in some of the improvements that we've seen in the now several hundred clients that we have worked with in the last few years. So one of the things that we get asked a lot is, can an individual supplement strengthen the brain? Like, couldn't you just put all of these different ingredients into one supplement? Or people will say, gosh, I've heard these supplements advertised, like Prevagen or Focus Factor. And do those things actually work? And it's an interesting question because it's not that different of a question than people saying, well, isn't there a pill I can take for Alzheimer's disease? Now, we're not just going to make this about brain health, but I would like to point out that what is good for the brain is good for the heart, and you can't help brains function better without not only helping the heart function better, but without calming inflammation and helping people have more energy and helping people lose weight and become much more metabolically healthy. In other words, I may have taken a few minutes here to talk about brain health, but it's all about the entire physical system. So the insights that come as Randy and I have worked with people to improve their brains really affect a lot of things in the body. So let's let Randy jump in now and take us through the rest of this presentation and really answer some of the questions that I raised at the get-go, starting with this question about, can individual supplements actually make a difference? Or is there another way to look at it?
Thank you. And before I go a whole lot further, I want to just throw out the typical FDA disclaimer that Eric and I are not treating anyone. We're not recommending a treatment. We don't want you to go out and change your whole routine based on what you learned today in this summary, because these statements that we're going to make today have not been approved by the FDA. This is not the practice of medicine by webinar, but it's basically to say, hey, look, we want to improve your information about how supplements can be used to improve total health. And these are opinion statements that you should run past your local family doctor. I will tell you that just about everything we're going to talk about today has a designation through the U.S. Food and Drug Administration called a GRAS designation. It means that these supplements are generally regarded as safe. They don't cause terrible side effects and long-term problems. They're just generally regarded as safe, and that's a designation that most vitamins and minerals have. So again, if you have specific questions, we want to point you back to your family practice doctor. But when we talk about brain health or brain fog or memory, I always get this question right off the bat about supplements, and it's, does Prevagen really work? Does Prevagen improve your cognitive function or your memory or your ADHD or your brain fog or whatever? And so I did a little research. I thought, okay, what is the secret sauce, if you will, of Prevagen? Prevagen was actually studied by the company in a small trial that showed that people who took Prevagen did better on some scores on their testing. This trial was not duplicated. It was not done by an unrelated company or a competing company, so the trial's probably a little bit biased. We do know that Prevagen has been tested at doses like 16 times what is in the actual molecule. The Prevagen secret sauce is called apoaquarin, and I've listed it up there, and it's generally recognized as safe. It's not going to cause long-term problems, but there's some debate and some argument about whether or not it's the secret sauce to memory. I personally don't recommend it all the time. I think it's kind of a pricey supplement, and there are some supplements with proprietary blends that I think can do just as well, and they cost a little bit more money. So there's kind of I'm going to wipe the question about Prevagen off the table. Okay, let's move on to the next one. This is a common supplement that you can buy at Costco. It's called Focus Factor, and I have a ton of clients with attention deficit, mood disorders, brain fog, and dementia that are always asking me, Randy, what's your opinion about Focus Factor? Now you can see I'm in full dress code today because I've been seeing patients in between us doing this little webinar. And so I thought, okay, I'm going to address Focus Factor too for those out there who have a question. The thing that I think is interesting about Focus Factor is you'll see it's like a multivitamin in that it is a proprietary blend of supplements. Here's what that means. In Focus Factor, they don't tell us the dosage or the strength of all of its ingredients. They just say this is a proprietary blend of these herbs or these vitamins and nutrients and minerals and so forth. And so I've highlighted a couple of those. It contains bacopa. Bacopa is an old Ayurvedic herb that has benefit in cognitive disorders. It contains phosphatidylserine. That's a necessary component in our cell membranes that has shown some benefit in cognitive disorders. It has tyrosine. Now, tyrosine is really interesting. Tyrosine is a precursor to dopamine, so it kind of helps us feel good. And anyone out there taking ADHD medicines like Ritalin or Adderall, you're basically taking a dopamine agonist, something that raises dopamine. So tyrosine can have some benefit. I've used tyrosine as a supplement for many of my clients with ADD. It has GABA in it, that big word, gamma aminobutyric acid. That's many of the same molecules or receptors that Ativan or clonazepam bind to, so it has a relaxing and calming effect. The very last supplement I listed or that I underlined, Huperzine A, is actually very similar to the medicine Aricept or donepezil, which is used in Alzheimer's disease. So you can see there's some phenomenal ingredients to this particular supplement. The challenge is we don't know what the blend is. And so I don't know how much bacopa or huperzine A you're getting, how much phosphatidylserine. Do we need to know? Does it matter? Well, I'm kind of the opinion, I think it does make a difference. For example, you can get too much huperzine A. And if you stop taking huperzine A very quickly, you'll have a rebound brain fog that can be a problem. So dosing actually does matter. While I'm not particularly averse to focus factor, I have a tendency to use supplements where I can look at the dose and adjust that dosing based on the outcomes and symptoms of the client. So there's just a little statement about proprietary blends, okay? So another question that people say was, well, I took this blend and it helped me, or I took this supplement and I didn't notice any difference. So will it work for everyone? The answer is no, I don't think anything works for everyone. And in fact, there's one of my mentors says, anything that claims it's going to fix everything, you should probably run away from, right? It probably isn't going to make a huge difference. So that becomes where personalized medicine becomes actually very beneficial in trying to figure out what could work for you. So I'm going to bring up some of the most common supplements out there and give you lots of good information and maybe some ways that you can avoid some pitfalls. So the first one is that vitamins and minerals, when they're deficient, can actually worsen cognitive disorders. I mean, that's given. We know that. We know if you have a deficiency in vitamin B, you are more prone to mental illness and more prone to brain fog and cognitive disorders. It's probably the reason that every energy drink in the world is loaded with B vitamins, okay? And the other thing we know is that there are many herbs, Ayurvedic herbs or nutrients or mushrooms that have been used for years, thousands of years, to improve neurological signaling. So we're going to talk about how we could apply some of those in specific brain health and in physical health. So the first one that I want to talk about are vitamin B deficiencies. Now, I would say that of all the vitamins, vitamin B is amongst the most prevalent, right? So does anyone have vitamin B deficiencies in our world because it's so prevalent? And I would say a resounding yes. I see it all the time. How do we have B vitamins in the environment that we work in? Well, I'll tell you one reason we have B vitamin deficiencies is that there is a growing trend to be vegetarian or vegan. And we get a lot of our B vitamins from animal products. So if you don't eat animal products, you are much more highly likely to have a vitamin B12 deficiency. Another one is that our society consumes a lot of alcohol. We've been taught that a glass a day of red wine is actually very beneficial from the antioxidant effect. While that is true, there are some antioxidants. It's probably overused and overrated, and there's a lot of great ways to get antioxidants besides alcohol. Now, does that mean you should never take alcohol? No, remember, I'm not talking personally, I'm speaking generally. The third reason I think there's a lot of B vitamin deficiencies is there's a lot of people who won't eat anything green. And we get a lot of our B vitamins from leafy greens and vegetables. In fact, a lot of the discussion today is that we should get 8 to 10 servings of leafy greens or vegetables every day. And trust me, that does not happen in our society. So for that reason, there's a lot of B vitamin deficiency. Now, speaking about vitamin B9 or folic acid, almost every woman knows when they get pregnant, they should take a vitamin that has folic acid to protect that developing infant from neural tube defects. Well, guess what? That should never change. We can get age-related neural defects when our vitamin B9 or folic acid is diminished. And so these are so super important. So just remember, if you don't want to take a supplement, you need to get plenty of animal proteins and plenty of your vegetables. And when that doesn't happen, B vitamins actually become very important. In our next slide, we talk about activated B vitamins. Now, let me explain what that means. Vitamin B12 and vitamin B9 and thiamine, all these B vitamins are typically in multivitamins galore. But you might be interested to know that most of them are synthetic vitamins. right? These are man-made, manufactured vitamins that have the appearance of B vitamins, but may not be exactly the same, and they're certainly not absorbed or metabolized the same. And so there's been a growing trend to look at genetic problems that cause people to have methylation issues. If you drink a lot of alcohol, you inevitably have a little bit of methylation problem. If you drink a lot of alcohol and you have a genetic disorder, you have probably big challenges with methylation. And methylation challenges can cause mental health problems. They can cause depression and anxiety. They can change the way that we detox, and they can raise a substance in our blood called homocysteine that's a problem. Years ago, there was a prescription medicine called Deplin that came out, and Deplin was used in depression refractory problems in individuals who just didn't respond to antidepressants. Now, the fascinating thing is that was just a methylated vitamin B9 in very, very high dosing. And I have used that in a lot of our clients, and remarkably, they make a huge difference. I have one young lady right now that's in her 20s who has just struggled with terrible depression her whole life. Most recently, we've really been ramping the dose of methylated B vitamins, specifically L-methylfolate, and she's done remarkably well. And so I'm a firm believer that these can make a difference in depression and anxiety and in detox formularies. So that's something to consider, and the dosing matters. And so you have to look at both methylated versions and dosing versions when you're talking about taking methylated B vitamins. Another thing that I hear all the time is vitamin D. And I was at my parents' this weekend, and my parents says, Randy, do I really need to take vitamin D? Do you have to take it? And I said, well, if you ran around outside with your shirt off so that you could get plenty of sunlight, no, you probably don't need to take vitamin D. The reality is it's 30 degrees where they live 6 months out of the year. There's snow on the ground, so the likelihood they need vitamin D is very high. Well, what about those people that already take a vitamin D supplement? How much should they take? Does dosing really matter? Do they take vitamin D2 or do they take D3? Do they take vitamin D with fat? Because fat or vitamin D is fat soluble and it's not absorbed very well if they don't take it with the fat. These are really good questions because vitamin D influences a ton of genetic reactions in our body. So instead of saying, how much vitamin D should I take to tip the scales, right? You want to take enough that you improve your total health and you improve that signaling that Eric talked about that can happen in the brain, the signaling that happens in our body that converts cholesterol to the hormone vitamin D. But you don't want to take so much that you end up with a kidney stone or a parathyroid disease, which can happen in ultra high dosing. So how do you know? Well, this is how you know. You check your levels, right? And we know that there is a sweet spot for vitamin D. My sweet spot is somewhere between 50 and 80 nanograms per deciliter when you check your vitamin D levels. When I tell you that's my sweet spot, it's because that's the protocol that I follow for helping people with neurological disorders. I have seen other practitioners that because of a history of a kidney stone or because of parathyroid disease, they may want to keep that level closer to the high 40s or 50s. Or I've had other people that push that level up into the 90s. And I've seen some naturopathic doctors that are very comfortable with those levels. So it just kind of depends. So I've listed what I look as my sweet spot for the goal of managing vitamin D. The question that you would then ask yourself is, not necessarily should I take 2,000 or 4,000 units of vitamin D, but probably take enough to keep your levels in that sweet spot. Because we know that some supplements can have a side effect, right? And I just explained to you some reasons why vitamin D levels that get too high can create challenges. Another one that we have to keep an eye on is vitamin E. So in vitamin E, it's a very powerful antioxidant, and it can do some nice things with our cell membranes and the way we transmit nerve impulses and so forth. The problem is that vitamin E in really high dosing can thin the blood. So if you're someone who's taking Coumadin or Xarelto or any of these medicines that thin the blood because you've had a stroke or you've got AFib or a DVT or whatever reason, you probably don't want to push vitamin E in mega dosing. You just want to keep that level at a therapeutic level between 12 and 20. And in the cognitive literature, I've tested many people whose vitamin E level is less than 6. That is significantly less than where we want that to get the antioxidant properties, right? So be thoughtful about not only how much you're taking, but what are your actual levels. All right, the next one that I want to talk about is magnesium. Most people know that magnesium is pretty amazing from a supplement. Most people don't know that it's considered a soft metal, right? And that magnesium actually competes with calcium. So you hear individuals will take a calcium and magnesium combination supplement. I've always found that fascinating because those two elements compete for absorption. If you absorb more calcium, you'll actually absorb less magnesium and vice versa. There's a great book out there called The Magnesium Miracle. I've referenced it right here by Dr. Carolyn Dean. And she talks about different forms of magnesium and why they're important. Let me tell you why they're important. The first one is that many magnesium supplements cause loose stools. That's why a lot of people take magnesium, because they poop every day when they take it. And we like that. We don't want you to have chronic constipation. There are forms of magnesiums that are considered salts, like magnesium oxide or magnesium sulfate, milk of magnesia you've heard of, that are designed to not get absorbed very well and help lube the pipe so that we can have a nice bowel movement every day. There are other forms of magnesium that are less likely to cause diarrhea because they're attached to an amino acid. We call that a chelated magnesium. So they're attached to an L-threonate molecule, or they're attached to a glycine molecule, and our body will absorb the amino acid, which then carries the magnesium up inside our body a little bit better instead of just pooping it out. Now, the reason that it's important to check magnesium levels is the same reason I talked about vitamin D and vitamin E. You want to know where your sweet spot is. And when we're checking magnesium levels, we typically check what's called a magnesium RBC. We want to know how much magnesium is attached to the cell membrane of a red blood cell molecule. That gives us the magnesium RBC level. And it's not uncommon for people to take magnesium and still have a very low magnesium RBC. So dosing matters, as does the therapeutic level within our bloodstream. That matters quite a bit as well. The next supplement I want to talk about are supplements that improve our gastric health. We live in a time where many people have taken antibiotics on many courses, or they've taken acid reflux medicine that changes the acid level of our stomach. When we do that, we actually change the bacteria that are downstream in our colon that can cause things like irritable bowel syndrome, or maybe people have been diagnosed with ulcerative colitis or Crohn's disease, or they're gluten sensitive, or all hosts of challenges. So what types of things can we do to improve our bowel health? And before I jump into supplements, the best thing to do is figure out the underlying cause. And I feel like that's what Eric and I do a lot of. It isn't just throw medicine at somebody when they've got IBS or throw a supplement. It's trying to figure out, why do you have IBS? And is it your medicines that causing it? Is it that you've been on too much antibiotic? Is it too much alcohol? Is it a major stress disorder? There's lots of things that we would sort through. The first thing that I hear when I talk about gut health is, what probiotics should I take? And I'm sure that if you're listening, you've probably asked that question. Is this a good probiotic? Some of the dogma or the talking points in probiotics that we've heard make a good probiotic would be things that are multiple strain, high dosing, like high CFUs, it stands for colony forming units or bacteria, and bacteria that can actually set up shop for keystone strains in our gut. Well, I particularly have recommended this probiotic for the past few months because it comes in spore form. Now, if you know anything about spores, spores are a protective coating around a live organism that can last the zombie apocalypse, right? They're just resilient to all types of terrible environments. But when that environment is good, that spore will open up, and whatever the organism is inside can set up shop and have an effect. So I typically use spore-based probiotics that help set up keystone strains and foster microbial diversity in the gut. And this is amongst some of my favorites, okay? The next thing to talk about when trying to improve gut health is prebiotic. Now, what's the difference between a probiotic and a prebiotic? A probiotic is taking the bacteria that we want to establish our gut health. A prebiotic is taking the foods or the supplements that those keystone strains like to eat so that they flourish and develop because they have a good diet of foods that they're going to eat. And so many of these prebiotics need to be fermentable or non-fermentable sugars that our body doesn't break down, but those bacteria will break down as their food so that we can grow keystone strains. And I've put some big words in there like Akkermansia, Mucophilia, and Ficobacterium prusnitzi. These types of bacteria are keystone strains that feed off those fibers in that prebiotic, right? And the nice thing is our goal is to try to reinforce the diversity. Now, if you feed the bacteria in your gut the wrong thing, you're probably going to grow the wrong bacteria. So that's why I'm a little bit more particular about prebiotics. But then again, everyone has to experience this to notice a difference. I was visiting with a young lady that did a service mission for her church, and she came home from that service mission in a foreign country and just had diarrhea for months on end. And when I recommended, let's try some things, she says, oh, I've been on some prebiotics and some probiotics for a long time, so I'm taking that. And my question was, how are you feeling? She's like, I'm not really doing any better. And my thought was, well, we need to switch it up then, right? So you have to be willing to roll with the punches and ebb and flow, because I'm a believer if you try something for 2 or 3 months and you notice no difference, we need to move on and try something new, because each one of us have a different microbiome and a diversity in there that we've got to feed. The last supplement that you might consider for your gut is a supplement that supports the mucosal lining of your GI tract. Now, the mucosa is this big, thick, gelatinous booger on the inside of your GI tract that protects your lining from all the bacteria and the strains and the toxins that get into our food system and that are in our environment. And the reason that mucosa is so important is it's part of your immune system. When that thing breaks down, you get leaky gut and you're more prone to autoimmunity. Well, one of the #1 medicines that break down that mucosal barrier is ibuprofen. And I'm hard pressed to find very many people that haven't taken a lot of ibuprofen in their lifetime. The other forms would be things like piroxicam and meloxicam and Voltaren. If you have any type of arthritis and gone to a doctor and they prescribe medicine, they prescribe medicines, or we prescribe medicine, because I've done that many times, that minimize that thick mucosal lining in the barrier. So when it breaks down, you start having other GI problems. This particular supplement is designed to support that GI mucosal lining and enhance it so your body can restore it. Naturally, that doesn't happen if we continue to take the contributor or the trigger that break down that mucosal lining, okay? The next supplement that I want to talk about is very commonly used in natural medicine for insulin resistance. And I brought this supplement up because so many of my clients have some element of insulin resistance. Remember, insulin resistance is a spectrum disorder. It ranges from very mild insulin resistance to very severe insulin resistance that then transitions right into diabetes. So if you've ever been told you're pre-diabetic, then you have insulin resistance. If you're diabetic, you have insulin resistance, right? So are the only treatments medicines? And the answer is no. In fact, lifestyle is a huge contributor to improving or eradicating insulin resistance. Berberine is another amongst my favorites, where when we start berberine, it's a very nice antioxidant and it changes the way that glucose is made naturally in the liver. And it acts a lot like metformin. One of the advantages is it often doesn't have the GI side effects that we see with metformin. So you might ask your doctor about, would berberine be a good supplement for me if you have insulin resistance? A nice companion to berberine is alpha lipoic acid. And you might think, alpha lipoic acid, I've heard of that. I've heard about it in the detox world. That's correct. It's used as a detoxing agent, but it's such a powerful anti-inflammatory, and it helps with diabetes that just do this. Go to your Google search engine and type in alpha lipoic acid. This is the very first statement that comes up on Google, and it says, well, most research on alpha lipoic acid in the treatment of diabetes has focused on neuropathy. Several trials have now found that alpha lipoic acid may increase insulin sensitivity to your own blood sugar and improve cholesterol. So it's way cool that these supplements exist out there. I can't tell you how many of my patients have never even heard of them or tried them in those instances. So visit with your doctor if alpha lipoic acid would be something that would be beneficial for you. Wrapping things up, another common thing that I hear about is chronic pain syndrome. So if people say, well, Randy, you talked about gut health, but then you talked about how anti-inflammatories affect that mucosal lining. What am I going to do with my arthritic pain? And I always ask them, have you tried curcumin or boswellia? More people have heard of curcumin than have heard of boswellia, but many people have not heard of either, okay? Curcumin and boswellia are natural herbs or natural remedies that have great evidence for treatment of chronic pain. Curcumin comes from the turmeric root. It's yellow, and it's often found in curry. It has that special flavor of curry or that spice. Boswellia is one of the active ingredients in frankincense. And given that we're in December and it's close to Christmas, I often remind my patients, no wonder the wise men brought frankincense to Jesus Christ, because in that day, it's what they used as a healing agent. It lowered chronic pain and had tremendous healing qualities. I was at a family event this last weekend, and I saw my sister dripping frankincense into a little homemade capsule. And she says, we take this at any sign that we start getting a scratchy throat. And she had her own little formulary of making her capsules with essential oils. I thought it was actually pretty special. I was excited for her. But it reminded me how frankincense is used in all types of things that have inflammatory disorders. If you have a chronic pain syndrome, this is an over-the-counter supplement that has been shown in a double-blind, placebo-controlled trial to compete with the anti-inflammatory and prescription called Celebrex, right? I think it's something that's worth a try if you have chronic pain and you're trying to protect your belly and be careful. So again, visit with your doctor about whether or not these supplements would be beneficial for you. As we get to the end of our discussion, I wanted to mention that some people will say, well, why did you talk about methylated Bs and vitamin D, vitamin E, gut health, curcumin? Why not talk about other supplements out there, like get focused just on supplements for attention deficit disorder, or more supplements for irritable bowel or leaky gut or candidiasis or SIBO? How about supplements oftentimes used in autoimmune disease or cardiovascular disease like vitamin K2 and bergamot, and I could just go on. And the reason is because there's not time available to go through every condition. But I just want you to know that I think there are some natural remedies out there that can compete with pharmaceuticals for improving total conditions without causing terrible side effects. And like Eric mentioned earlier today, when the body is strengthened, the brain is strengthened. And when we strengthen our brain or we focus on brain health, it's amazing to see that all of the cardiovascular risk factors seem to improve, right? I've seen people with low GFR and kidney function who, when we're just focused on their brain, all of those elements seem to get better. It's kind of like a rising tide raises all of the boats in the harbor. So be aware that supplements have their place in the world. They can make a difference. They're not indicated necessarily to get rid of all of our prescription meds, but when used with a very thoughtful approach, in dosing that is contemplated with a healthcare professional, trying to raise levels to therapeutic doses, people can see some remarkable benefits from that. So with that message, Eric, what questions might I be able to answer?
Well, if you're watching, you've probably been thinking of some questions as we've gone through that, through this presentation. And we appreciate you being on today, and we want to make sure that we answer your questions. So if you could go ahead and type those into the Q&A box, we'll address as many of them as we can. But while you're doing that, I want to have Randy talk us through some common things that come up. So Randy, one of the things that almost everybody that we have worked with asks about is, there are so many different brands of supplements. How do you begin to choose one and have any sort of confidence that it might be really good quality and that you're getting the active ingredients that are on the label?
Oh, great question. And I hear this all the time. Eric, you and I went into the co-op last week to get a GABA supplement, and it's mind-blowing how many brands there are out there, right? So generally speaking, I look for brands that are well-known and have multiple products. Another thing is I've just become very familiar with the supplements. So my patients will often ask me, do I have a brand-specific recommendation or no? And at 50% of the time, I don't have a brand-specific recommendation for vitamin C or for vitamin D, right? I think that if you know what you're getting and it's a reputable company, you're probably going to do okay. But the flip side of that is I am very particular about GI supplements, about methylated B supplements, about cognitive supplements. I think it does matter. And that's just such a broad question. It's difficult to answer in short term. So I've kind of given you some general rules. There's a couple of questions that have come in. One question is there a specific time that I should take my probiotic? And if you're taking a probiotic because you've been on an antibiotic, generally speaking, you want to split the difference. So if you're taking an antibiotic in the morning and in the evening, the best time to take the probiotic is smack dab in the middle of the day, because there's some theory that that antibiotic will destroy your probiotic, right? The second part of that question is if you're not on antibiotics, it probably doesn't make a big difference of when you take your probiotic. Another question that just came in is, should I feel different when I take my supplements? And my answer is, what are you taking them for? Most of my patients cannot tell a difference between a vitamin D level of 50 and a vitamin D level of 30. They can't tell the difference. But it's not uncommon with any of our clients that after they take a group of supplements for a period of time, they start saying, gosh, my energy is going up. I'm starting to feel a little bit better. The flip side of that is if you feel no different after taking your supplements for 3 months, I think you should regroup. You should talk to your doctor. You should do an evaluation, maybe look at therapeutic levels to determine, should I take that supplement or should I make an adjustment in the supplements that I'm taking or in the dosing and so forth? Great questions.
One of the things I'd add to that, Randy, is that these supplements often work best when they're addressing problems in the context of the human system. So a lot of times people will take an individual supplement and they'll want to get the benefit of that supplement, and they'll have a set of improvements in mind that they plan on feeling. And yet if they aren't addressing other major factors that could be moving them in the opposite direction they want to go in, then it may be that what they're taking actually is having benefit, but it's overshadowed by all the things that they are not addressing. I think that speaks to the need for a programmatic approach where you have to really take apart the whole human system and say, what are all the factors that are leading to this? So for example, if you want more energy and yet you've got an underlying thyroid problem that hasn't been addressed, you're probably not going to feel like that vitamin D supplement is doing a ton for you.
Yeah, and Eric, I would add to that the term supplement means it's supplemental to something, meaning I don't think it works very well to eat fast food every day of your life and be a couch potato and never exercise and think you can take a handful of supplements and really change your health. Those supplements aren't going to supplement your fast food diet very well. And I guess it could minimize the onset of scurvy, right? But that's a joke, of course. The other thing that you said earlier today that resonated with me because of a client that I saw this morning is you said, many people argue, well, I'm just going to have expensive urine. And I said, expensive compared to your $5 Starbucks coffee or expensive compared to your $3.50 energy drink? Like, that's pretty expensive urine too. So the difference is you could take a lot of supplements to compete with your $5 coffee and your $3.50 energy drink. That's $8.50 a day. Trust me, you could take a truckload of supplements and never equal $8.50 of expensive urine, right? And then we can be very intentional about what we're trying to approach. And I'll add one last comment about that before we wrap up. I'm a firm believer that supplements should be individualized and tailored. I am not a huge fan of saying, oh, I read in Sports Illustrated that creatine improves muscle mass, so everyone that exercises should take creatine, right? Or that I read in Reader's Digest the other day that everyone should take this herb maca. And if we take this maca for flavonoid, we're all going to do better. I don't subscribe to that theory. I very much believe in sitting down with an individual and sorting through their health challenges and then picking and choosing a group of supplements based on research that might benefit that person. And I'll give one case study. I have a young patient that's about 46 years old that is in really good health but wants to be engaged in preventive strategies down the road. And so we actually looked at some genetic tests. And we found out things from those genetic tests that I had never anticipated in that individual. And it has changed my recommendations for supplementation. So we can be very intentional. That's my style of medicine. I think that works well for the individual. And I've not been disappointed because if an individual comes back, it's not uncommon that they say, Randy, I feel great. Now, here's one last example about that topic. I had a 30-year-old girl with rheumatoid arthritis that came into the clinic and said, I've tried all of the prescription medicines from a rheumatologist and I feel awful when I take them. Do you have any recommendations of things that I can try? And I gave 3 supplement recommendations. One of them was for a digestive enzyme. Okay, I'm not even going to go into why. The second one was for a medicine called LDN or low dose naltrexone. It's actually a compounded prescription, but it's not a pharmaceutical made supplement, right? And then we did one other lifestyle change. This person recently sent me a text and the text said, Randy, I thought you were crazy when you recommended I take a digestive enzyme and LDN, but I cannot tell you that my pain is 99% gone. Those recommendations came because we talked through the challenges that that individual was having. And we specifically thought, okay, well, let's try these 2 supplements and this one lifestyle change. And in that person, it had an amazing result. That's very different than reading a book and taking 9 supplements for autoimmunity. So again, I think supplements should be personalized towards the individuals and the challenges.
Thank you, Randy. It sounds like a lot of what you're talking about is supplements play a role in an overall approach toward really personalized medicine, root cause medicine, where instead of looking at symptoms and trying to diagnose symptoms and then treating it with a pharmaceutical agent, maybe a different approach is to ask why that's happening. What has changed in the physical system and how can we address the underlying physiology at work? And supplements are a part of that. To briefly get back to the question that so frequently comes up is to, well, how do I know which supplement to choose? How do I know if it's working? I think one of the most important answers that I've learned from you about that, Randy, is that that's why you measure things. That's why you work with a provider who's actually going to do lab work that looks at some of these root cause issues. The truth is, if someone is taking a vitamin D supplement that we've never heard of before, but when we test their labs, we find out that they've gone from 10 nanograms per deciliter up to 50, then we know that that supplement worked and it was effective. And if they're feeling better in the context of the overall program, then it makes sense to do it.
Yes, and Eric, go back to B vitamins. Everyone takes a B vitamin. And how many times have you seen someone take a B vitamin and we look at vitamin B1 and B9 and B12 and it's low, it's subtherapeutic. Have you seen that happen?
Oh, it happens constantly. And then you look at, you mentioned homocysteine earlier briefly. Homocysteine in high levels can be damaging to the brain and to the heart. And it can increase your risk of thrombotic events. And we see it elevated in people all the time who are taking a B vitamin supplement. And earlier in the conversation, we'll talk about B vitamins and they'll say, yeah, I'm taking a B vitamin supplement. And we sort of assume, I think, at least in the general public, that, yeah, if I'm taking my vitamins, I'm doing everything I need to. But there's a measuring component, and things take on a totally different picture, and you learn different things when you actually measure these things.
Yes, and let me give our listeners an analogy. Let's say that you have chronic pain and you take a hydrocodone, and your hydrocodone's of 5 milligrams. Well, let's say you take a quarter of that versus you take 20 milligrams of morphine. The magnitude of difference in that dosing is out of this world. The difference between a quarter milligram of hydrocodone and 20 milligrams of morphine, right? That happens all the time in B vitamins. If you look at the proprietary blend on a B vitamin, the standard dose of folic acid is 0.4 of a milligram. And it's synthetic in the first place. If you look at L-methylfolate from MethylPro, and you're getting 10 milligrams of L-methylfolate, number one, the supplement's different. Number two, it's a 40 times difference in magnitude of dosing. That matters when you're addressing mental health or detox or energy levels or a whole host of things that require high levels of B vitamins.
Right. And yet it's probably not safe for someone to just kind of armchair quarterback this and say, well, I think I've got this issue. We're talking about complex genetic factors, things that only show up in lab work, and it takes a
you want some
qualified
guidance
practitioner to dial it in.
For sure. Yep, for sure.
So, well, we could go on, and it's been a fun discussion. I hope it's been really valuable for all of you who have participated today. We hope you'll join us for future webinars where we're just sharing information that we've learned through the course of trying to help as many people as we can optimize their health. If you have any specific questions about material presented today or in other webinars, or even there's some lingering question about something in your own health, whether it's with brain health or something else in your physical system, we invite you to reach out. We'd be happy to have an offline conversation with you about your specific situation. And we hope if you enjoyed the material today, that you'll share it with other people. We'll go ahead and post this webinar on our YouTube channel, so it'll be out there in the next couple of days. We hope that you'll share it with people. And if you're not already subscribed to A Mind for All Seasons on YouTube, go ahead and subscribe. We'll put lots of helpful information out there on a regular basis. So thanks again for watching. Thank you, Randy, for your involvement today and for all you've done to help so many thousands of people optimize their health. Since we're right around Christmas time, we'll tell all of you Merry Christmas, Happy New Year, and hope you've enjoyed all the holidays that are special to you. Thanks, everybody.
That's great.
We'll see you again soon.
Thanks, guys.